The following segment is brought to you by Intermountain Healthcare and the Utah Department of Health.
If a family member is diagnosed with coronavirus, there are some simple things that you can do to help prevent it from spreading throughout the household. Mary Nichols explains some of the steps you should take.
It's simple concepts. It's not different from the things that we tell people to do in the community, but it does require some specifics.
If you're caring for someone who is diagnosed with coronavirus, there are some easy ways to reduce the risk of you or the rest of your family getting sick. Depending on the symptoms, as soon as someone's diagnosed, they need to go into home isolation.
And home isolation means they didn't really have symptoms or a severity of illness that really dictated them being in the hospital or needing to be in the hospital, so they can be at home.
It's important for the infected person to avoid as much close contact with other members of the house as possible.
Social distancing, hand washing, and wearing a mask are really important even within the household.
Isolate the infected family member in a separate room and have them use a separate bathroom if possible. Choose one person in the household to be the caregiver.
Having one member of the household be the person who helps take care of them with a mask, limiting the number of times they actually come within close contact.
Properly caring for the infected family member could help prevent coronavirus from spreading.
So both those measures, quarantine and isolation, are so important to stop the next transmission. If I can stop that early on through quarantine and isolation, then we can stop the spread of disease throughout an entire community.
Mary Nichols for Check Your Health.